Okay, I'm going to do my hand sanitizer as I come into the room. I'm washing my hands. Hi Kelly, we're going to do the other part of your exam. We already did the first part. Now we're going to do the musculoskeletal, check out your abdomen, and do some neurological testing, okay?
All right.
Okay, very good. Okay, first things first, we're going to check out your abdomen. So if you could go ahead and lay down for me, that would be great. Okay, yep. Are you ticklish at all?
Nope.
Okay, very good. Okay, the first thing I'm doing is I'm looking at his abdomen and I'm looking for any masses, palpations. I'm looking at the skin color, quality and condition, making sure there's no redness, any pulsations. I do note a scar here. What happened here?
It was a three-wheeler accident when I was a little kid.
Oh, okay. Any problems or any with that?
Nope.
Okay, so we'll mark that down. Did you have surgery or did it just heal as it was?
Healed as it did.
Okay, because we would want to know if you had any surgeries of any sort. Okay, very good. Okay, so now that I've inspected his abdomen, I'm going to listen to your abdomen, okay? So I'm going to listen to all 4 quadrants and I'm listening for any bowel sounds, okay? So, and I'm listening with the diaphragm of my stethoscope. Very good. Normal bowel sounds are about between 5 and 34 bowel sounds per minute, so yours are very normal. The next thing I'm going to do is use the bell of my stethoscope, and I'm going to listen for your aorta, and I'm going to listen to your renal to make sure you don't have any bruits. Okay?
Okay.
All right. Listen to your renal. Okay, very good. I don't hear any bruits, and that's normal, okay? I'm going to take my stethoscope off here. The next thing I'm going to do is I'm going to palpate. I'm going to palpate lightly all 4 quadrants and deeply, okay? So as I'm palpating, let me know if you have any pain or any tenderness. Is there any pain or tenderness? Okay. Now I'm going to palpate deeply. Any pain or any tenderness with that?
No.
Okay. I'm also going to do some tympani. Okay, so you may have some dull sounds throughout, but that's just probably fecal matter, and if I crossed an organ, that would be dull too. So it doesn't hurt, or if it does, you let me know, and I'm just going to okay, very good. So it was appropriate dullness across, so there was no problems there. The next thing I'm going to do is I'm going to palpate for your liver. Well, we're going to palpate and I'm going to do some tympanic work all the way up there too. So your normal span of your liver is between about 6 and 12 centimeters, okay? So I'm going to palpate from, or I'm going to use tympani or percuss from here, and when I hit dull, that's going to be the edge of your liver, and I'm going to mark that, and I'm going to do again down through here, mid-axillary, and I'm going to use my, I'm going to use percussion, and when I get to, if I hear dull, then that's the edge of your liver as well, okay? So as I'm going to scoot your shorts down just a little bit, and I'm just going to percuss. Okay, about right here, it just started to get dull. Okay, so now I'm going to go about right here. So your liver span is about right there, okay? All right, so now I'm going to go to the other side and I'm going to check your spleen. And I'm going to go medially to laterally outward, okay? And I'm looking for any enlargement of your spleen, okay? So I'm going to percuss as I'm going across, okay? And I don't hear any dullness, so you don't have an enlarged spleen. Okay, so the next thing I'm going to do is I'm going to palpate for your liver, and I'll palpate for your spleen. So I'm going to find the edge of your intercostal right here. Okay, and I'm going to have you take a deep breath for me. Okay, and out. Okay, right there. Okay, so I feel the edge of your liver and it's very demarcated, and that's what we want. So I can feel it very easily when I palpated it. Now I'm going to palpate for your spleen. So I'm going to right through here, I'm going to hold right through there. I'm going to take a nice deep breath. Okay, out again. Very good. Okay, I don't feel any enlargement. Did you have any pain with either of those?
No.
Okay, great. The last thing I'm going to do is check for acute appendicitis. So these are some special maneuvers, they're called. So we're going to check rebound tenderness. So I'm going to push real hard on your right side, and I'm going to let go real quickly. And if you have any pain, you let me know. Okay, so you ready? Okay, I'm going to push real hard. Ready? Up. Any pain with that?
No.
Very good. Okay, then I'm going to check your psoas and your arbitrator muscles. Okay, so your psoas, these were the muscles that innervate, and if you had any pain, that would maybe point to appendicitis. So what I'm going to do is I'm going to have you take your thigh and push up against my leg. Push, push, push. Very good. Okay, any pain with that?
No.
No. Okay, now I'm going to have you bend your knee, flex your knee like this, up, and I'm going to turn it to the inside. Any pain with that?
No.
Okay, so that's negative for any acute appendicitis. So we did your obturator, your psoas, we did our rebound tenderness, and everything was very good with that. Okay, the next thing I'm going to do is I'm going to do, since you're laying down, you can go ahead and put your tank top down. We're going to check your hips and your pelvis. So what I'm going to do is I'm going to feel for your greater trochanter right here. Very good. Any pain or any tenderness with that?
No.
Okay, I'm looking for any crepitus or any crunching. So now I'm going to have you do some range of motion. So what I'm going to have you do is, can you scoot to the edge of the bed a little bit? No, scoot to the edge of the bed because we're going to do your extension. There we go. Okay, now go ahead, just drop your leg down. Okay, very good. Extension. Any pain with that?
No.
Okay, all right. Now we're going to flex your leg. Flex. Any pain with that?
No.
No? Okay. Now we're going to abduct out. Any pain with that?
No.
Now we're going to adduct. Any pain with that?
No.
No? Okay. Now I'm going to put your knee up here, and we're going to do some internal rotation and external rotation. Any pain with that?
No.
Okay, very, very good. Okay. So the next thing I'm going to have you do is I'm going to have you sit up here, and we're going to do some more of the musculoskeletal exam. So I'm going to go ahead and I'm going to feel your jaw, and I'm going to palpate right here. Can you open your mouth? Ah, and shut it. Very good. Any pain with that?
No.
Okay, I didn't feel any clicking, so that's very good. If you just turn your head slightly, I'm going to feel your vertebrae going down. And your paravertebral muscles right here. You can go ahead and look at me again. Very good. Okay, any pain or tenderness with that?
No.
Okay, next thing we're going to do is we're going to do our range of motion. So we're going to flex. We'll do it together. Extend. We're going to go lateral to the right. Left. Okay, very good. Sorry, I mixed you up. Okay, and then we're going to turn your head side to side. Very good. Any pain or any tenderness with that?
No.
Okay, very good. The next thing we're going to do is we're going to move into your shoulders. We're going to do your, I'm going to feel for your AC joint, your glenohumeral joint, and then I'm going to feel for your bicipital groove. Okay, bicipital groove. Very good. Any pain with that?
No.
Okay. So now we're going to practice our range of motion. So we're going to flex together. Oh, I'm sorry. Wait, that's for our elbows. We're gonna do the adduct. Sorry for your shoulders. Adduct. Okay, or abduct. Now we're gonna cross. Yep. Go ahead. Cross one arm. Okay. Now cross the other arm. Very good. So that's adduct. So this is abduct and adduct. Okay. Now we're gonna do our flexion. So we're gonna hold it at 90 degrees, and then we're gonna go 180 degrees. Okay, flexion. Now extension is behind. It's kind of hard with the bed, I know. So flexion, very good. Okay, now we're gonna do our internal rotation and our external. So internal rotation is behind our back, very good. Now external rotation is like our football goalpost. We're gonna go like this, okay, just like that, and then we're gonna go up, very good, and down. Okay, very good. All right, you can drop your arms. So that is that was our external rotation. So we did internal rotation, external rotation, we abducted, we did our flexion and our extension. Okay, very good. So now we're gonna move on to our elbows, and I'm gonna palpate your humeral epicondyle and your olecranon process. And humeral epicondyle process, okay, very good. All right, so now we're gonna do, okay, ready? We're gonna flex, we're gonna extend, okay. Now we're gonna hold our hands out like this. Okay, now we're gonna go supination and pronation. Supination, pronation. Very good. Any pain or tenderness with that?
Nope.
Nope. Oh, okay. Now I'm gonna move on to your wrists, and I'm feeling for your ulnar styloid and your radial styloid, your ulnar styloid, radial styloid, and then I'm gonna feel for your carpal bones, okay? Everything feels good through there. Any pain or any tenderness?
Oh.
Okay, let's do our range of motion. We're gonna flex, we're gonna extend, very good. And then we're gonna do ulnar deviation and radial deviation. Ulnar deviation, radial deviation. Very good. Okay, sounds good. Now we're gonna move into your hands. So I'm going to palpate your metacarpals. I'm palpating your metacarpals, very good. I'm looking for your MCPs. Okay, MCPs, your PIPs, and your DIPs, the distal interphalangeal. These are like all your knuckles, so these are landmarks that are really important. Okay, so now what I'm gonna have you do is I'm gonna flex your hands, and I'm gonna extend your hands. Yep, and then we're gonna go abduct and adduct together. Okay, very good. Any pain or tenderness with that?
No.
Nope, okay. Now we're gonna move down to your knees, okay? I think, could you just scoot back a little bit? Yeah, make sure you're, okay. So I'm feeling for your femoral condyles, your tibial condyles, your lateral spaces, your medial spaces, and then your tibial tuberosity. Very good. So can you bend your knees? We're gonna flex your knees. Very good. Now put them straight out. Very good. So that's your extension, okay? Any pain or tenderness with that?
No.
Okay, can you scoot back, and then we can look at your ankles and your feet. Scoot back a little more so the camera can see you. Very good. Okay, so now I'm looking at your ankles. I'm looking laterally at your lateral malleolus and your medial malleolus. Any tenderness?
No.
Okay, now we're gonna go through your range of motion. So I'm gonna have you flex towards your face, okay? Step on the gas pedal, extension. Now I'm gonna have you evert away, yep, very good, and invert towards you, very good. Okay, looks good. Any pain with that?
No.
Okay, now we're gonna move on to your feet. I'm gonna feel for your tarsals as I'm palpating your tarsals through here, very good. Any pain or tenderness?
No.
Okay, now I'm looking at feeling for your MCPs, okay, your PIPs, and your DIPs. Okay, any pain or tenderness?
No.
Okay, so now I'm gonna have you flex your toes. Yep, squirrel them up in a ball, and now put them out again, extend, very good. Okay, now I'm gonna have you abduct out, if you can pull them out, very good. And then put them back together, nice and tight, very good. And you're on adduction, okay, very good. And I do notice that you do have some tinea pedis, which is the common athlete's foot. So we'll make a note of that, and we'll make sure to put that, we'll make sure to get that taken care of, okay?
Okay.
All right, okay. So now we did your feet. Okay, now if you could scoot forward, and we're gonna do your spine. Yep, so if you could stand up. Oh, and since you are lifting up your shirt, I remember there was one more test that we needed to do. This is one of our special maneuvers, and this is looking for any problems with your kidneys, okay?
Okay.
So this is called CVA tenderness. So I'm gonna hit your back and you let me know if you have any pain, okay? Ready? Any pain?
No.
Okay. Any pain?
No.
Okay, very good. Now since you have your shirt up, it makes it real easy. So I'm just looking at your spine. It's very midline. Your vertebrae look very good. We already did your paravertebral. Now I'm just looking at your spine process, and it looks like you have a little scar through here. What was that from?
Back surgery when I was 21.
Okay. Do you have any problems with that?
No.
Okay, very good. All right, we'll make a note of that and we'll put that in your file for sure. Okay. So now we're going to go through the range of motion with your spine. So go ahead and let's face the camera. Okay. So together we're going to flex and we're going to touch our toes. Very good. Okay, now we're going to extend back. Okay, very good. And we're going to go lateral to the left, lateral to the right, and now we're going to turn to the left, and then we're going to turn to the right. Any pain with that?
No.
Okay, very good. You can go ahead and sit on the bed. Now we're going to look at your neurological status, and this is your cognitive function. So this isn't a trick question, but how do you spell world backwards?
DLROW.
Very good. Now we're going to look at your higher intellectual functioning. Okay, so I'm going to ask you a question. If you were in a burning building, what would you do and how would you get out?
I would get my family to the nearest exit.
Okay, very good. All right. Okay, so that means that your higher intellectual functioning is intact. Okay. Okay, so the next thing we're going to do is we're going to look at your cranial nerves, okay? So we already did a lot of them in the first part of your exam, and he passed them all with flying colors, but we're going to walk through them real quickly, okay? The first thing we're going to talk about is your cranial nerve 2. Everything was working, that's your optic, and visual fields, visual acuity, we used the Snellen chart, you had perfect eye vision, no problem. Now we're looking at 3, 4, and 6, cranial nerve 3, 4, and 6. Those all have to do with the eyes too, so we're looking for pupils equal reactive round to light, and that's 3, and that's how your pupils reacted, and they were 3 millimeters, and that was perfect. And we're also looking for any ptosis, any drooping of the eyelids, and that's 3, and then extraocular movements if there was any nystagmus, but that was all good too. So that's 3, 4, and 6. Now we're going to go to 5, the trigeminal, and now I'm going to get a tongue depressor here. So I have a tongue depressor. And the trigeminal number 5 consists of motor and sensory. So what I'm going to have you do is I'm going to put this in your mouth. Go ahead and can you bite down? And I'm going to pull it. Very good. Other side. Bite down. Pull. Very good. Okay, so that means that your motor cranial nerve 5 is intact. Now we're going to look at sensory. So I have a Q-tip, and one side is soft and one side is sharp. And I'm going to have you shut your eyes, and as I go around, you're going to tell me if it's soft or sharp, okay?
Okay. Soft, hard. Soft, hard. Soft, hard. Soft, hard. Soft, hard.
Okay, very good. Pass with flying colors. So that means that your sensory is working appropriately. Now we're going to move on to 7, your facial. So I'm going to have you smile for me, frown, squint your forehead. Okay, very good. So that means that number 7 is working properly. Number 8 is the whisper test. We already checked that for your hearing. It's your acoustic, and that worked properly and it was perfect. So then we're going to go 9 and 10. Your uvula rose midline when we checked your 9 and 10. Okay, then now we're on to 11. This is your spinal accessory. So what I'm going to push down here, and you're going to push against me with your shoulders. Okay, very good. Now I'm going to hold my hand here. Go ahead, push against me. Very good. Now push against me. Very good. Okay, so that is all working 100%. Okay, the next thing I'm in is 12. So that's when you stuck out your tongue midline. So go ahead, stick out your tongue. Very good. Your tongue is midline. That means your hypoglossal is intact and cranial nerve 12 is working perfectly. The next thing I'm going to do is I'm going to move into your muscle bulk. And so what I'm doing is I'm looking at all of the muscle that you have. Everything is even. I would be looking for any unusual movements, any tremors or fasciculations. So I don't see anything that would be unusual. Next thing I'm gonna do is I'm gonna move into your motor strength. So I'm gonna have you make 2 fists like this, okay? Now, go ahead, push against me. Very good. Now push out to the side, okay? Now I'm gonna go like this, push towards me, okay? Very good. Now I'm gonna have you push your knees up. Oh, okay. Push out, okay? Push in, okay? Down here, push out, push in, okay? Now push up, okay? Now push down like a gas pedal. Okay, very good. So all of your strengths are 5. Lastly though, I'm gonna check your shoulder girdle. So I'm gonna have you put your arms out in front of you and turn the palms of your hand. Okay, and shut your eyes. Very good. I'm looking for any drifting or any pronation if it would turn like that. So you can open your eyes. So everything is very normal. So definitely 5 out of 5. Oh, and lastly, I want you to hold my hands and grab my hands for hand strength. Yep. So I'm gonna hold my hands, yeah, like this. Go ahead, grab them. Very good. Okay, so that means you have equal and bilateral hand strength, and that's very good. Okay. All right, and next thing we have, oh, the sensory. We got a little more sensory to do, and these are testing your dermatomes. So these are all of your limbs, all the way up and down. So once again, I have sharp and soft. So you shut your eyes and you tell me sharp or soft, okay? Ready?
Hard, soft, hard, 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 soft, hard, soft, hard, soft.
Okay, now I'm going to move down to your limbs here.
Hard, soft, hard, soft, hard, 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 soft, soft, hard.
Okay, very good. So that means that your dermatomes are working and you can feel the difference between soft and hard, and that's really important. There's some other components to the test. So what I'm going to do is I'm going to use my tuning fork. So I have my tuning fork here. And what I'm going to have you do is you're going to hold out your hands like this, okay? And you're going to shut your eyes and you tell me when it stops, okay?
Stop. Stop.
Okay, now I'm going to do your feet.
Stop. Stop.
Okay, very good. And lastly, we're going to do our position sense. Okay, so our position sense is holding your hands like this, and then I'm going to go up with your finger or down with your finger, and I'm going to do that with your great toe, and you need to tell me if it's up or down. So go ahead, close your eyes.
Up, down, up, down.
Okay, I'm doing your great toe.
Up, down, up, down.
Okay, very good. So your position sense is intact. The next thing we're going to do is we're going to test your deep tendon reflexes. Okay, so I have my reflex hammer here. So I'm going to have you hang your arm out like a scarecrow. Okay, so we're going to check your tricep. Okay, very good. Okay, now relax your arm and we're going to check your bicep. Very good. Now your brachial radialis. Just relax your hand in mine. Very good. Now we're going to check your patella. So relax your knee. Oop, gotta have it hang there. Very good. Okay. Very good. Okay. Now we're going to dorsiflex your heel, and I'm going to do your Achilles. Oop. Very good. Now if you could just scoot back for the camera here. We're going to do your plantar. So what I do is, it kind of feels a little bit uncomfortable, but I'm going to go up and around. Very good. So that was a negative Babinski or plantar reflex. So that's very good. Okay, go ahead and sit to the edge of the bed here. Okay, so we're going to do some cerebral functioning, and this is for coordination. So you can follow me here. Okay, so it's just go like this. Okay, very good. Okay, Now can you paddle your feet? Paddle, 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 paddle. Just do your feet. Very good. Okay, your feet work very good and you're able to follow that. The next thing I'm going to have you do is we're going to check your cerebral functioning again, but we're going to have you watch your gait. So if you want to stand here back by me. Okay, so now we're going to go walk. 1, 2, 3, 4. Okay, turn around. Okay, now you're going to go heel to toe. Okay, now heel to toe, heel to toe, heel to toe. Very good. Okay, now turn around. Let's look at the camera. That was very good. So that was when you checked your gait, your heel to toe. Now we're going to check the Romberg. Okay, so we're going to stand with our arms out, and then you're going to shut your eyes. Okay, and I would look for any swaying or any drifting, and we would do this for like 20 to 30 seconds. And that looks very good. Yep. Okay, you can go ahead and sit down. There's a couple more things that we need to do. If you were a female patient, I would have to do a breast exam on you, or we would do a breast exam on you. And we would look for size and symmetry and the contour lesions and any skin. And even as a male, we would look through all of that, your pectoral muscles, and make sure that everything, there's no masses or swelling or tenderness, okay? And then we would look for your cervical nodes, and we would look for central, lateral, pectoral, and subscapular. And lastly, we'd also check, your nipples or your areola, and making sure there's no tenderness, masses, or lesions, and then if there was any sort of abnormal discharge. There is one thing I forgot to check on you, which was your abdominal span. So if you want to lay back, and we'll just check that real quick. Okay. So I'm going to feel for it right through here. Between 2.5 centimeters, that's what it's about normal. So I'm just going to check for it. And this is your aortic span right here. Excuse me, I said abdominal and I meant aortic span. Okay. Very good. Yep, I can feel it. And it's about the normal span that it should be. So, okay. Well, that concludes our wellness exam for today. Kelly, you did a very good job and you passed with flying colors, okay?
Thank you.
Thank you.